What would you do if a patient is upset or angry?
In my experience, patients often feel upset when they are in pain, afraid, or feel unheard. I remember a situation in a medical ward where a middle-aged patient became very angry because his procedure was delayed for several hours. He started raising his voice and refused to cooperate with the staff. My first task was to ensure his safety and calm the situation without escalating it. I approached him slowly, kept my voice calm, and gave him space to express his feelings. I listened carefully without interrupting, which helped him feel respected. I acknowledged his frustration and said I understood why he felt upset. Then I explained the reason for the delay in simple terms and reassured him that he had not been forgotten. After that, I offered small support, like checking his comfort, updating him on the expected time, and informing the doctor about his concerns. I stayed with him for a few minutes until he became calmer. As a result, the patient relaxed, apologized for his reaction, and agreed to continue care. This experience taught me that patience, empathy, and clear communication can turn a difficult situation into a positive one.
How do you handle responsibility?
I handle responsibility by staying organized, being accountable, and always putting patient safety first. In my previous role, I was responsible for caring for 8 patients during a busy shift in a medical ward. Each patient had different needs, including medication schedules, wound care, and monitoring vital signs. My task was to make sure all care was delivered on time and without errors. I started by planning my shift, setting priorities, and double-checking all doctors' orders. I kept clear notes and followed proper procedures, especially during medication administration. When the workload increased, I stayed calm and focused, and I was not afraid to ask for support from my team when needed. One challenge I faced was managing multiple tasks at the same time while ensuring accuracy. To handle this, I used a checklist and regularly reviewed my progress throughout the shift. I also communicated clearly with colleagues during handovers to avoid mistakes. As a result, all patients received safe and timely care, and there were no incidents during my shift. This experience showed me that handling responsibility means being reliable, attentive, and committed to high standards at all times.
What is teamwork in nursing?
Teamwork in nursing means working closely with others to give safe and effective care to patients. It involves clear communication, mutual respect, and supporting each other during both routine and challenging situations. I experienced this during a busy shift in a surgical ward where we had a sudden increase in patient admissions. Our team included nurses, a doctor, and support staff. My task was to help manage patient care while ensuring nothing was missed. One challenge was the time pressure and the number of patients needing immediate attention. I focused on clear communication. I updated my colleagues regularly, asked for help when needed, and also offered support when others were overwhelmed. For example, I assisted a colleague with wound dressing while she helped me monitor vital signs for another patient. We shared responsibilities based on urgency and skills. As a result, all patients were attended to on time, and we maintained a safe and calm environment despite the pressure. This experience showed me that teamwork in nursing is about trust, cooperation, and working together to achieve the best outcome for patients.
What motivates you to become a nurse?
My motivation to become a nurse comes from a strong desire to care for people and make a real difference in their lives. I have always been drawn to helping others, especially during times when they feel vulnerable or afraid. I remember when a close family member was hospitalized for a serious illness. I saw how the nurses not only provided medical care but also gave emotional support and comfort. One nurse, in particular, took time to explain procedures clearly and treated my family with kindness and respect. That experience showed me how important a nurse's role is, not just in treatment, but in giving hope and reassurance. Since then, my goal has been to become a nurse who provides both skilled and compassionate care. During my training and work experience, I found satisfaction in simple things like helping a patient feel comfortable, listening to their concerns, and seeing their recovery progress. What keeps me motivated is knowing that even small actions can have a big impact on a patient's well-being. Nursing allows me to combine my skills, empathy, and sense of responsibility to support people when they need it most.
What will you do if you make a mistake?
If I make a mistake, my first priority is patient safety. I act quickly and honestly. I remember a situation during a busy evening shift when I realized I had given medication later than the scheduled time. It was not harmful, but it was still an error. My task was to correct the situation and prevent any risk to the patient. I immediately informed the senior nurse and the doctor. I closely monitored the patient for any changes and documented the incident clearly as per protocol. I also explained the situation honestly to the patient in a calm and respectful way, which helped maintain trust. The challenge was feeling stressed and concerned about the mistake, but I stayed focused and followed proper procedures instead of trying to hide it. After the situation was stable, I reviewed what went wrong. I found that the delay happened due to poor time management during a heavy workload. As a result, I improved my practice by using better prioritization and setting reminders for critical tasks. This experience taught me that being transparent, responsible, and willing to learn is very important in nursing.
What do you know about patient care?
Patient care means providing safe, respectful, and holistic support to meet a patient's physical, emotional, and psychological needs. It is not only about giving treatment, but also about ensuring comfort, dignity, and clear communication. In my experience, good patient care starts with proper assessment. I check vital signs, observe changes, and listen carefully to the patient's concerns. One challenge I faced was caring for an elderly patient who was anxious and refused medication. My task was to ensure he received the treatment while respecting his feelings. I took time to sit with him, spoke in a calm tone, and explained the purpose of the medication in simple words. I also involved a family member to build trust. Instead of forcing, I gave him time and reassurance. Gradually, he agreed to take the medication. I also focus on basic care like hygiene, nutrition, and pain management, while maintaining privacy and dignity at all times. Clear documentation and communication with the healthcare team are also very important. As a result, the patient became more cooperative and comfortable. This experience taught me that patient care is about empathy, patience, and treating each person as an individual with unique needs.
What is professionalism in nursing?
Professionalism in nursing means maintaining high standards of behavior, skills, and attitude at all times. It includes being respectful, responsible, honest, and committed to providing safe and ethical care. I experienced this during my work in a hospital ward where I cared for patients from different cultural backgrounds. One challenge I faced was handling a situation where a patient's family was unhappy and questioned the care being given. My task was to manage the situation calmly while maintaining trust and dignity. I listened carefully to their concerns without becoming defensive. I remained polite, explained the care plan clearly, and followed hospital policies. I also involved my senior nurse to ensure transparency and proper communication. Even under pressure, I maintained a calm tone and respectful behavior. Professionalism also means being punctual, following guidelines, maintaining patient confidentiality, and working within my scope of practice. I make sure my uniform is neat, my documentation is accurate, and my communication is clear. As a result, the family felt reassured and became more cooperative. This experience taught me that professionalism is not only about knowledge, but also about attitude, integrity, and how we treat others in every situation.
How will you manage your studies and personal life?
I manage my studies and personal life by planning my time carefully and setting clear priorities. I understand that both are important, so I try to keep a healthy balance without affecting my performance. During my training, I had a busy schedule with classes, clinical duties, and family responsibilities. My task was to stay focused on my studies while also taking care of my personal well-being. One challenge I faced was feeling tired and stressed during exam periods. To manage this, I created a simple weekly plan. I set specific times for studying, assignments, and rest. I broke large tasks into smaller parts so they were easier to complete. I also made sure to get enough sleep and take short breaks to avoid burnout. When I felt overwhelmed, I spoke with my mentors or friends for support. I also used my free time wisely, such as reviewing notes for a short time each day instead of last-minute studying. This helped me stay consistent. As a result, I was able to complete my studies on time while maintaining my health and personal relationships. This experience taught me that good time management and self-discipline are key to maintaining balance.
How would you handle a family member who is angry about a patient's care?
I understand that family members may feel angry when they are worried about their loved one. I would handle the situation with patience, respect, and clear communication. I remember a situation in a hospital ward where a patient's son was upset because he felt his mother was not getting enough attention. He raised his voice and questioned our care. My task was to calm him and address his concerns without creating more tension. I first listened to him without interrupting, even though he was emotional. I maintained a calm tone and gave him space to express everything. One challenge was managing his anger while staying professional. I acknowledged his feelings and said I understood his concern. Then I explained the care we were providing in simple terms and reassured him that his mother's needs were being monitored closely. I also checked the patient again in his presence and updated him on her condition. When needed, I involved the senior nurse to ensure transparency. As a result, he became calmer and more cooperative. This experience taught me that active listening, empathy, and clear information can help build trust even in difficult situations.
Can you give an example of a time you calmed someone down?
I remember a situation during a night shift when a patient became very anxious before a procedure. She was breathing fast, crying, and saying she was scared something would go wrong. The environment was busy, which made it more challenging to give her enough attention. My task was to calm her down and help her feel safe before the procedure. I first stayed with her and spoke in a soft, calm voice. I encouraged her to take slow, deep breaths and follow the pace with her. I listened to her fears without interrupting and acknowledged that it was normal to feel afraid. One challenge was that she was not responding at first and kept panicking. So I changed my approach. I explained the procedure step by step in simple words and reassured her that the team was prepared and would monitor her closely. I also held her hand for comfort and reduced noise around her as much as possible. After a few minutes, her breathing slowed, and she became more relaxed. She agreed to continue with the procedure. This experience showed me that patience, empathy, and clear communication can help calm someone even in a stressful situation.
What if a patient is angry for a reason that is not your fault?
If a patient is angry, even when it is not my fault, I still take responsibility for managing the situation professionally. I understand that patients may be in pain, stressed, or afraid, and their reaction is often not personal. I remember a situation where a patient became upset because his discharge was delayed due to administrative issues. He was frustrated and directed his anger toward me. My task was to calm him and support him, even though the issue was beyond my control. I listened to him without interrupting and allowed him to express his frustration. One challenge was not taking his words personally. I stayed calm, maintained a respectful tone, and acknowledged his feelings. I explained the situation clearly in simple terms and assured him that I would check for updates. I then contacted the concerned department and followed up on his case. I kept him informed about any progress so he did not feel ignored. As a result, he became calmer and appreciated the updates, even though the delay remained. This experience taught me that empathy, patience, and communication are important, even when the problem is not directly caused by me.
What does accountability mean to you as a future nurse?
Accountability to me means taking full responsibility for my actions and always ensuring patient safety. As a future nurse, it means being honest, following standards, and accepting both success and mistakes. I experienced this during my clinical training when I was responsible for monitoring a patient's vital signs regularly. One challenge I faced was managing multiple tasks at the same time during a busy shift. My task was to make sure all observations were done accurately and reported on time. At one point, I noticed a slight change in the patient's blood pressure that could have been easy to ignore. Instead of overlooking it, I rechecked the reading to confirm and immediately reported it to the senior nurse. I documented everything clearly and continued close monitoring. Being accountable also means not hiding errors. If something goes wrong, I believe in reporting it, learning from it, and improving my practice. As a result, the patient received timely medical attention, and the condition was managed early. This experience taught me that accountability is about being reliable, attentive, and always acting in the best interest of the patient, even in small situations.
Describe a time you had to take charge of a situation.
I remember a situation during a clinical shift when the ward suddenly became very busy, and one of the senior nurses had to attend an emergency in another room. At the same time, a patient in my area started feeling dizzy and weak after getting up from bed. My task was to take immediate action and ensure the patient's safety. One challenge was that I had limited supervision at that moment, and I needed to stay calm and act quickly. I asked the patient to lie down safely and checked vital signs right away. I noticed a drop in blood pressure, so I suspected possible postural hypotension. I called for help while continuing to monitor the patient. I reassured the patient to reduce anxiety and ensured they were comfortable. I also informed the returning nurse clearly about the patient's condition and the actions I had taken. At the same time, I guided a junior staff member to assist with other patients so that care was not delayed. This helped keep the situation under control. As a result, the patient stabilized, and no further complications occurred. This experience taught me that taking charge means staying calm, acting quickly, and making safe decisions even under pressure.
How do you ensure you don't forget important tasks during a busy shift?
During a busy shift, I make sure I stay organized and focused so that important tasks are not missed. I understand that even small mistakes can affect patient safety, so I use simple and reliable methods. I remember a shift where I was caring for several patients with different medication times, wound care, and monitoring needs. One challenge was managing multiple tasks at the same time without confusion. My task was to complete everything accurately and on time. At the start of the shift, I prepared a clear plan. I wrote down all tasks, including medication schedules and special instructions. I prioritized patients based on urgency. I also used a checklist and updated it as I completed each task. This helped me track my progress throughout the shift. When interruptions happened, I paused and then reviewed my list again to stay on track. I also set reminders for critical tasks and communicated with my team to ensure nothing was missed during handovers. As a result, I was able to complete all tasks safely and on time. This experience taught me that good planning, prioritization, and consistent checking are key to managing a busy workload effectively.
What would you do if you disagreed with the doctor's order?
If I disagree with a doctor's order, my priority is patient safety while maintaining respect and professionalism. I understand that nurses have a responsibility to question anything that may be unclear or unsafe. I remember a situation during my clinical training where I noticed a medication dose that seemed higher than usual for an elderly patient. One challenge was speaking up, as I was still a student and did not want to seem disrespectful. My task was to ensure the patient received safe care. I first double-checked the order and reviewed the patient's records to confirm my concern. Then I approached the doctor politely and asked for clarification, using a calm and respectful tone. I explained what I had observed and why I was concerned. I also involved my senior nurse to support proper communication. The doctor reviewed the order again and realized there had been an error in the dosage. It was corrected before administration. As a result, a potential risk was avoided, and the patient remained safe. This experience taught me that it is important to speak up, communicate clearly, and work as a team, even when it feels challenging.
How do you handle a team member who is not pulling their weight?
I handle this situation with patience, respect, and clear communication. I understand that there may be reasons behind a team member's behavior, such as stress or lack of confidence. I remember a shift where one colleague was not completing assigned tasks on time, which increased the workload for others. One challenge was managing my own responsibilities while feeling the pressure of extra work. My task was to ensure patient care was not affected and to address the issue professionally. At first, I supported the team by covering urgent tasks so that patient safety was maintained. Then, at an appropriate time, I spoke to the colleague privately. I asked if they needed help and listened to their concerns without judging. I kept my tone calm and focused on teamwork rather than blaming. I also clarified our responsibilities and encouraged better coordination. When needed, I informed the senior nurse so that proper guidance and support could be given. As a result, the colleague improved their performance, and the team worked more smoothly. This experience taught me that addressing issues early, with respect and teamwork, helps maintain a positive and safe working environment.
Why is communication critical in nursing teamwork?
Communication is critical in nursing teamwork because it ensures safe, clear, and coordinated patient care. Without proper communication, important information can be missed, which may lead to errors or delays. I experienced this during a busy shift in a medical ward where several patients needed close monitoring. One challenge was handling multiple tasks while also sharing updates with the team. My task was to make sure all important information was passed clearly and on time. I made it a point to give accurate updates during handovers, including changes in vital signs, medications, and patient concerns. I also communicated immediately if I noticed any changes in a patient's condition. I used simple and clear language so there was no confusion. When receiving instructions, I repeated key points to confirm understanding. There was a situation where a patient's condition started to change slightly. Because I communicated it early to the team, the doctor was informed quickly, and action was taken without delay. As a result, the patient received timely care, and complications were avoided. This experience taught me that good communication builds trust, reduces errors, and helps the whole team work together effectively.
What keeps you motivated on a difficult day?
On a difficult day, what keeps me motivated is my sense of responsibility toward my patients and the impact I can make, even in small ways. I remind myself that patients depend on us not only for treatment but also for comfort and support. I remember a shift where the workload was very heavy, and I was feeling physically and mentally tired. One challenge was staying focused while managing multiple patients with different needs. My task was to continue providing safe and compassionate care despite the pressure. During that time, I focused on one patient at a time and stayed organized. I also reminded myself why I chose nursing. A small moment that helped me was when a patient thanked me for simply listening to her concerns. That reminded me that even simple actions matter. I also take short moments to reset, such as deep breathing or a quick pause, so I can continue with a clear mind. Support from colleagues also helps me stay positive. As a result, I was able to complete my duties safely and maintain a caring attitude. This experience taught me that purpose, small positive moments, and teamwork help me stay motivated even on difficult days.